Next page, ma'am.
Started your time.
Yes, ma'am. Next page, ma'am. Next page, ma'am. Next page, ma'am.
That's okay.
That's it.
No, these are the props. Okay.
Next thing, ma'am. Any other pages we have on?
You just need to have that
Okay, fine.
consent paper of this. Okay.
Yes, ma'am.
Started 10 minutes.
Hi, I'm Dr. Muthulakshmi, one of the ST5 doctors in the clinic today. How may I call you?
Catherine is fine, doctor.
May I confirm your age, please?
I'm 32-year-old.
Catherine, I can gather from your GP letter. We are here to discuss about the sterilization procedure. Am I right?
Yes, doctor. I wanted to undergo this procedure.
Okay, Catherine. So, Catherine, since we are meeting for the first time, shall I ask you a few questions? Then I will explain about the procedure. Then we can plan the procedure.
Oh, yeah, that's great.
So, Catherine, may I know the concern behind the sterilization?
Uh, Actually, doctor, I'm using pills and I'm very sure that I don't want any baby here onward. And these pills are making me little fat. I have
Mhm.
started gaining weight, so I decided I don't want, and I'm okay to go this procedure.
So, please tell more about your periods.
My periods are pretty regular.
Mm.
Because I'm on pills, so they are regular. Last period was 2 week back.
2 weeks back. Right. So, and I can see your notes here up to date with your smears, right?
Yes,
So,
yes.
and you have two kids, and both were born vaginally, right? Hello?
Uh, Again, I have 2 kids and they both were delivered vaginally.
Mm. So, and any other medical conditions you are visiting your GP regularly?
No, I am otherwise fit and fine, doctor.
Fine. Okay. And any allergic to medications you have?
No, I'm just allergic to this egg yolk. Apart from that, I do not have any allergy.
So, I'll note it down. And any surgeries done in the past?
No.
A few personal questions. It is important for the management. Is it okay to ask?
Yeah.
And any sexually shared infections either for you or your partner in the
No,
past?
no, no, no. Me and my partner is together since last 7 years, and I have been in this relationship. With both of us are very loyal to each other. Never had this.
So, do you smoke?
Oh yeah, it's to smoke 10 to 12 cigarettes a day.
Drink alcohol?
It's only occasionally during parties, nothing special.
Height weight ratio?
I'm little plumpier. I do have a height weight ratio of maybe 30. My weight
30.
is little high because of that pills.
Blood group?
I think it's positive.
Any reservations for transfusion in case necessary?
No worries.
So, what do you do for your living?
I am not working as present. My husband is into the building firm and he earns a very good amount. So I took a break for my kids.
Good to know. And how is your support at home?
Oh, yeah, George is very supportive.
So, Catherine, shall I examine you in the presence of your chaperon, check your observations and tummy, and check
Oh,
the neck
yeah,
of the womb?
yes.
Thank you. So, uh, before we discuss about the sterilization, so what are you aware about the sterilization procedure?
I just know that it's a surgery to clip the tube and then you will not get pregnant. And I don't want to get pregnant.
So, are you aware of the other options? Have you used it before? Contraceptive option.
I have used pills and
Hmm.
Georgie has used condom for some time.
So, are you aware of some long-acting contraception like coils, rods? Have you heard about that?
Actually, doctor, I am pretty sure that I do not want a baby, so
Okay.
I have not thought of it. But okay, I will be listening.
Sorry.
I will be okay to listen.
Okay, fine. So, I'll explain about both surgery and the other options also. Okay.
Hmm.
So coming to the surgery, so this is the womb and this is the tube and this is the ovary. So what we do is in procedure, sterilization, we'll block the tube either by putting a clip or a ring. It is usually done by a keyhole surgery. Am I
Okay.
clear so far?
Okay. Yeah, quite
Okay.
clear.
Yes, and it is a permanent procedure.
Oh, yeah, I know that.
Yes, and it is usually done under anesthesia. Either it may be a full or it may be injection at the back, and which will make you numb below the waist. Okay.
Okay.
And this procedure is straightforward procedure, but however it is a major surgery. There are some complications like injury to the nearby structures like womb, gut, and infection, bleeding, so and anesthetic complications. Okay.
Okay.
And which will be little more in a women with increased height to weight ratio.
Okay.
Okay. So, and the thing is, even though it is a permanent procedure, so it has got some failure rate of around 1 in 200.
Yeah, so it do fail.
Yes. So, all contraceptive options have some failure rate.
Okay.
Okay. So, and if failure happens and it happens pregnancy happens most commonly in the tube. So,
Hmm.
whenever the periods are missed, so we need to check the pregnancy test and we need to check whether pregnancy in the tube.
Okay.
Okay. And also, we need to follow safe sex practices like condom to protect against sexually shared infections even after
Hmm.
the procedure. Am I
Uh,
clear, Catherine?
yeah, doctor. Basically, we are in a single partner relationship.
Uh,
Okay, go ahead.
yes, Catherine. So, but still, we need to follow this for safety of our health.
Okay.
And also, we are using pills, though this needs to be taken till the next period after the surgery.
Okay.
Okay. And this usually done during the periods or within 10 days of periods to avoid accidental pregnancies. Mm, am I clear,
Mm.
Catherine? Any concerns in this
Mm.
procedure you're having?
No, no, not the concerns. So when
Okay.
can I undergo this procedure, doctor?
Yes. So we'll put you in the list. So as soon as possible, we can undergo the procedure and preferably within during the periods or within 10 days of the periods.
Okay.
Yeah. Okay. So shall I explain about the other options?
Yeah.
So we have other options called coils and implants, so and also injections. So coming to the coils, copper coil and hormone coil, are you aware of it?
I have listened. Yeah, you can just tell me what exactly.
Yeah. So these coils are usually placed in the womb during your periods, like how we take pap smear in the OPD with your consent in the presence of a chaperone.
Okay.
Okay. So these coils we can be kept for 3 years or 5 years or 10 years, like for copper coils. So and when we don't want, we can remove it. So then fertility will get resume after this, and it has got less failure rate compared to the sterilization, and it is a reversible one.
Okay.
So coming to the complications, usually it is a very easy procedure, but sometimes during insertion there will be a pain, fainting episodes, injury to the womb or neck of the womb, and sometimes it might get very rare complication might get through and through the womb. It can go to the tummy, but that usually a rare thing.
Okay.
Okay. And every time after your periods, we need to check for the threads. And if the threads are missing or not able to fill, then you need to report to the hospital. Okay.
Okay.
So you want me to explain about rods and
No, doctor,
injections?
it's okay. It's okay.
Okay. And we have got the other option that is for the partner, what we call as a vasectomy. Have you heard about it? That?
Actually, my partner is not at all keen, doctor.
Okay.
He is not very sure whether he wants, he's maybe wanting kid. So that is
Okay.
one thing keeping me.
Mm.
Okay, but it
So,
was a good discussion.
okay, so any concerns?
No, no, nothing, nothing.
Okay, so and I'll also give a detailed patient information leaflet, inform my consultant, and also I'll make you in the OT list name and this consent paper. One copy I'll give it to you, and one copy will put it in the records. And anytime you can withdraw from your consent, that is your wish. And also it is recommended to follow the general health to quit smoking.
Okay.
So yes, complications will be more, especially if you're undergoing for a surgery and also when you're on a pills.
Okay, so do I need to stop pills or do I need to continue the pills?
Yeah, so pills you need to continue till the next period after the surgery.
Okay. Okay.
Thank you.
Thank you. Okay. Completed well within time. Last 2 3 minutes
Yes.
only. Means few seconds only. And
Okay,
that
ma'am.
smoking would have, it would have been better off if you would have addressed smoking and that drug somewhere early, little early.
Okay, ma'am. Drugs means, ma'am?
Not drugs, smoking and weight.
Ah, yes, yes,
BMI,
yes.
high BMI. Okay, so that is the only point. Condom, actually, she is in a very loyal relationship, so you cannot, means, you can skip that question, dear.
Okay, ma'am. Okay.
See,
Mm.
basically, means if she had any infection then you can
Yeah.
emphasize on that, but
Yes,
here
ma'am. Okay.
she is with the partner since last 7
Mm.
years, the kids are with the same
Mm.
partner, so you can skip that thing. Then rest of the task is very perfect. You checked why she's very keen on this, everything was perfectly placed. Anybody wants to give a suggestion or any feedback to Dr. Muthulakshmi, we will be welcoming them. Only one question here, what I think is COC. COC needs to be started pre-surgery, but ensure she will not be pregnant. Okay, because on hormone replacement, these are the hormones basically. Smoking, hormones, and
Mm.
BMI high. This puts her at increased risk of blood clot formation.
Yes, ma'am.
Okay, so that point was missed out. Then
Mm.
means no, that is an unsafe practice to continue pills till you get a
Mm.
period. Okay, so that is an unsafe practice. Secondly, she needs to do all baseline blood investigation, including blood in and then PSC. She needs to be seen by the PSC
Ah, yes,
doctor.
ma'am.
Okay, so then only the consultant we will be giving her. Yeah. Meanwhile, she can continue her weight reduction regimens also,
Mm.
because it will another 3 or 6 months she might be
Mm.
accepted. It's a routine procedure. Okay.
Yes, ma'am.
And patient information leaflet specific PIL you have to say. So
Yes, ma'am.
PIL of LARC and
Sterilization and lark.
both PIL you have to give. There isn't any support group, so you can skip that. So these are the only points what I had filled, what I feel. Anybody wants to say anything which I missed, she missed?
Ma'am, ma'am,
Hmm?
as her age is only 32, is there any, I mean, a chance of regret, ma'am?
No, it is less than 30.
Then 20, less
Okay, ma'am.
than 30, ma'am. You should
Yeah, less than 30, but still you
30.
have to mention that there is a chance you may regret this decision in
Okay,
future.
ma'am.
And no, this is not available. It is the recanalization is not available on
NHS.
NHS. That also you need to say. And if it all and failure is completely 1 in 200, what you have mentioned. And
Mm.
if failed, then the chances of ectopic pregnancy. That also you need to mention.
That I told, ma'am. Ectopic
Hmm.
I told.
Yeah, so that is a few things what you have to say. So regret whether it is less than 30, more than 30, you just need to tell them that yes,
Yes,
we
ma'am.
have seen movement, especially in those who are less than 30, that they have regret. Anybody wants to say anything? Good point picked up by Dr. Manikam ma'am.
Thank you, ma'am.
Anybody? Anybody?
Ma'am, we have to stop OCP 4 weeks back, right?
Before.
Before 4 weeks. Before 1 month, we have to
Yeah,
stop, no,
at
madam?
least, yeah, at least what I learned from this our part 2 exam, they generally stop all hormonal pills at least 4 weeks before. Yes.
Okay. Then
But
what
then at that,
contraception?
yeah. So in this case, you can just tell her that if you want to stop, so I will suggest to use effective contraception for that month. Even she can use condom, and we will be doing a urine pregnancy test for that cycle. That is also important point. She needs to use contraception, but it should not be hormone containing pills if she has to undergo surgery.
Okay, ma'am.
Can she use, ma'am, can she use progesterone only pill, ma'am? No.
Progesterone only pill, at least she can try. Yeah, we
Okay.
will not go in detail basically. We will just say that since it is not safe to continue hormone pills till the date of surgery, so it will be stopped 4 weeks prior. She needs to use alternative contraception during that time. She can use copper coil or she can use condom. And we will be doing urine pregnancy test to see whether it is you are pregnant or not. So
Thank
that
you,
can
ma'am.
be said to the patient.
I mean, in this talk, she was using microgyne, no, ma'am. That is a POP, no? Yeah.
Microgyne, I think it is COC dear or POP.
No, ma'am. Microgyne is POP, microgynon.
Okay, then she can continue it. She can
Yeah, that's
continue
what I
it.
told.
Yeah.
Continue till this
Yes.
thing.
Then
If
in
it is if
that
a
case,
Dianet means it comes as OCP, then she
COC.
needs to stop.
Yeah. So microgyne she can continue. So in
Mm.
actually in exam they will not give some such thing as something like that. They will specially mention POP or COC.
Okay, ma'am.
Okay. Basically, you need to know what is microgyne, and according to me, we can just
I just
search.
put in Google. It came as
Yeah.
LNG.
Hello, ma'am.
Huh?
Yeah. So, ma'am, I have just now searched regarding this combined hormonal contraceptive. So, the FSRH is telling that there is no evidence to support stopping combined hormonal contraception prior to surgery or the use of thromboprophylaxis in women undergoing uncomplicated procedures such as this laparoscopic tubal sterilization. So that what
Okay.
is written. Like not like that in the routine gynecological surgery, as we are telling, like HRT and this combined hormonal
HRT,
contraceptive, we are
yes,
stopping.
HRT definitely we need to stop. That is very
Yeah,
sure. HRT
and that
definitely we
they've
need.
written.
But here
Yes, yes,
actually she's having multiple other risk factors. Smoking is there, high BMI is
yeah,
there. So that is
yes,
my
yes.
concern. At least you can
Mhm.
mention that she is at risk of clot formation.
Yeah,
Even if
yeah,
it
yeah.
is a minor surgery, so she will be assessed for that. We can say something like that.
Yeah, like all the other risk factors also, yes.
Yes. Okay.
I mean, the
So,
microgynon, many brands are there.
Exactly.
Some are having combined.
yeah, so we need to know
Yeah,
what exactly
we,
it is.
yeah, we need to tell if it is a combined hormone. We can say it is
Yes. So,
operative.
yeah, then that kind of sentence will be very specific.
Yeah, ma'am. Yes.
Okay.
Better to stop the combined hormonal
Combine,
pill
yeah,
before.
because
Yeah,
otherwise
safe.
you just need to tell her, no, it is okay. You can tell her that we will be stopping it to prevent the risk of clot formation,
Clot
because
formation.
there are other risk factor in her case, like high BMI
BMI,
and
smoking.
smoking, and
Smoking.
she has to stop smoking also.
Hmm.
Okay.
Okay.
And ma'am, another information is it is written like here it is written that 7 days only after the sterilization, 7 days to be continued, not like that until the next.
Yes.
Yeah,
Yes.
until the
Yes.
next.
Yes. Yes. Yeah.
Yeah,
Yeah.
so that
Definitely.
is
That
the
is quick starting. Yeah.
yeah.
Yes. Anybody? Nice discussion.
Ma'am, how about the vasectomy? Should we mention to her?
Yeah, so here why I am not stressing too much on vasectomy, because her partner wanted more kids. So I am
So,
not stressing too much on vasectomy. I will be just giving her an option. Lark male. See, here the patient is not that high risk where you will be discussing the alternative like vasectomy. Vasectomy should be discussed in cases where the patient is not medically fit. There is one task in the RCG exam where the patient is epileptic. She had previous ectopic, she had previous surgeries, previous cesarean section, and I think smoking plus. So there are multiple risk factors. So in this case, putting her on table and undergo and performing the surgery will be little difficult. Okay, because the medical fitness is there, obesity will put her at increased risk of injury, complications while insertion, and completion of procedure. We might not be we might not be clear whether we will able to identify the tubes with previous to cesarean and ectopic, or we may have to abandon the surgery. So in this case, definitely we can discuss we can stress little more on that vasectomy as an alternative option. But in this case, I'm not, I have just although the answer key has mentioned, but I am not stressing out too much. I will just tell her that okay, there are other options. If your partner, you can bring your partner, we can discuss including vasectomy. So we can just suggest her that we can discuss the vasectomy, that is a male sterilization. But I will not emphasize or too much stressing out on that vasectomy thing, because the patient is having only two risk factor. That one, she is little bit obese, that is BMI is 30, still okay. 75, the BMI has not been given here, but she is obese. And secondly, smoking. So we can take it as an opportunity to guide her regarding smoking cessation services. Okay, it is not good for health, so you can consider, and it increases the complications, healing, post-operative healing, wound healing, and also increases the chances of blood clot formation. So I will take it it as an opportunity to discuss that. Along with that, I will just discuss, suggest her about LARC, not too much stress out on or emphasize on vasectomy. That is my idea in this task, although the book has mentioned that.
thank you, ma'am.
Anybody? Anybody? Okay, so shall we go ahead with the answer key? I really like the way you started, dear, and the way you said why you are, means, so I would like to appreciate, or you just need to appreciate why she is very keen on this surgery. Any particular reason why she wants? Okay, so that why is information gathering here. Very important, huh? So introduction, and you had completed your history taking also within time. So you had almost 6 minutes 10 seconds for your task completion, and it's a big task because you have to explain her about lab sterilization also, and you have to explain her about LARC also. and you just need to check her suitability. So only few points were missed here and there, but see to it this will not be also missed out next time. Okay. So history of open question. GP mentioned already that 2 vaginal deliveries they had mentioned 2 year back last one and 4 year back first one. Any particular reason why she is very keen on permanent sterilization? Because lab sterilization. Okay. What contraception she has used previously? You need to ask. You had asked me. Menstrual history very important. I have means according to my knowledge, microgynon is COC, so I had mentioned here about COC. Okay.
Yes, ma'am, it is COC. Yes, yes, you are
Yeah,
right.
according to my knowledge, it is COC. Then acknowledge mere acknowledge she is medically fit. It has also been mentioned. Surgical history has not been mentioned. BMI has not been mentioned. So when she said I have increased the weight, that time also you can ask what is your BMI. Allergy egg yolk. So they mentioned that propofol contains egg yolk substance. So we need to notify to the anesthetist that it will not be used. BMI is high. Smoking alcohol, you have to acknowledge and you have to guide her regarding quit smoking services. Alcohol occasionally is okay. Blood group you can ask. Drugs support. Okay. Any medication, not basically. Just wait. Okay, so drugs basically any medication she is on and support. What are her partner's view? You can ask here. Means one question, did she discuss it? Because she's in a long term, since long she's been relationship. So you can ask here partner's view. What are her partner's view? That might be a question in the lay examiner or information gathering sometimes. Okay, so you can ask this question. Hmm? Okay,
Okay, ma'am.
just wait, just wait. Support. Then offer examination, BP per abdo, per speculum per vaginal examination. I have not offered here. You can offer. It depends upon that. Any infection, you can take a swabs also. I have skipped out on that STI history. I have skipped. I just wanted to know whether it in surgery, to see whether there are any risk factor. Okay, you can ask STI history because you just wanted to see whether there are any adhesions. Okay, so that much history is still okay. Even painful menstrual history also you can ask whether there is any painful history because you just wanted to rule out whether there are any pelvic adhesions associated with PID or endometriosis. Then draw and explain because that's the reason I have clipped here. Okay, I have mentioned shown this figure. Always draw, explain, and you mentioned that it's a permanent contraception by a keyhole surgery. Small telescopic instruments will be introduced through your belly button, and we will keep both the fallopian tubes. Okay, so by clipping the tubes, the pregnancy will be prevented by blocking fertilization of egg and sperm, and it will be done under anesthesia. So mechanism of action you have to explain. Pros. So it's a permanent procedure. The pro is it will be a permanent procedure and you may not need to use any contraception to prevent pregnancy here. One can be very at least relax. One can be at least relaxed. She does not need to use any contraception. So permanent, but the cons are it is surgical related. It's related to the anesthesia. So surgical related is injury, bowel, bladder, difficulty inserting the trocar, risk of injury. Uh, that is 1 in 500. Regret, failure, that is 1 in 200. Failed risk, and if failed there is a risk of ectopic. And one or two things again you can say that sometimes it is difficult in certain patients to enter into the tummy also and to complete the procedure that they had mentioned in the consent also. So that point even I had not mentioned here, so you can mention very nicely. Did you want to discuss alternatives? Here you can just ask. If she says okay, or you can just try to convince, do not try to convince her that might not be in the role player, but you can just tell her that okay, so lark is something which you just need to take once in a while, once in a month, and it is more effective than the advantage of lark is it is more effective than the in this surgery. The risk of failure is less and it is reversible. Okay, so these are the advantage of lark. So would you like to take some time and she would like to discuss with her partner, you can just ask her here, okay? Because that is also included in the task where you have to discuss all the options of LARC with the patients. But prior to surgery, we need to evaluate your fitness for surgery and urine pregnancy test to rule out pregnancy. So full blood count, blood grouping, urine routine, and assessment by anesthetist. Okay, so this will be done. The benefit of this surgery, permanent surgical method, contraception, 99% it is effective in preventing you pregnancy, and it does not interrupt your sexual life. Okay, it does not interrupt your sexual life. And here you can also mention that it will not prevent STI. Okay, not prevent STI. So sometimes they would like to hear, but the risk of surgery and anesthesia there, this is basically duplication again. Sometimes it may be difficult to enter into the tummy and complete the procedure. There will be a regret if done less than 30 years. This sentence you can use. No recanalization offered an NHS. Risk of failure, and if so, chances of ectopic pregnancy risk is 2 to 5. Alternatives are there which are having advantage of being more effective than sterilization. Reversible is positive, and they need to be taken once in a month only. So do you want to discuss? So there are available in different forms, that is loop, that is copper coil and LNG, injection, that is DIMPA, and implants. So these are the alternatives which are available. If you wish, I can give you patient information leaflet about LARC, sterilization, and discuss. LARC methods, okay, so I had just shown you some slides. It is very difficult for you people to explain everything in that few seconds about LARC. So you just need to tell these 2-3 points. Mechanism of action is all of these will be prevent. Some are hormonal, so they will prevent egg release and implantation. And the non-hormonal, basically it will prevent implantation. Okay, so this much is sufficient. In one sentence you can tell about this hormonal, non-hormonal. The next, what you can tell them, how long. So injection needs to be taken every 3 monthly. Implant is for how many years? 3 to 5 years. Okay, there are two types of implants. Copper coil is for 3 to 5 years or up to 10 years also, and this LNG also 5 years. So hormone containing is high 5 years, non-hormonal containing is, depending upon the copper content, 5 to 10 years also. The risks are there with the hormone loop. There will be chances one only you are going to tell them. You are not going to go into the detail because you will not be having that much time. So with the loop or coil, there is a risk of infection, so antibiotics will be given to prevent the infection. You here you can mention and stress upon, to prevent sexually transmitted infection, here you can use condom as an alternate, means double method also. This is another option. Implant, it is progesterone containing, so yes, water retention and some hormonal side effects she might experience, okay, sometimes. It is reversible, and it can be removed, and this is small surgical implant. Okay, DMP, again the same thing. Obesity, means she is having that weight gain problem, and all those associated with the DMP, that is bone mineral density, it will be minimizing. So these are the hormones which will be available. So you just need to tell some points up, about all these things. And if she wants to conceive with the DIMPA, the chances of getting ovulation will be delayed in this case. So 1 or 2 points you just need to tell her. Okay, at least the examiner will be, oh, why this is okay, the examiner will be like, okay, she has discussed. Okay, so all the options. Then if not keen on this, the alternative male sterilization is an option. If interested, we can discuss whenever your partner will be available. Whenever your partner will be available. Continue COC till we accept you for surgery. Okay, so here I had just a broader subject is continue your contraceptive pill till we accept you for surgery. Weight reduction is an important key to minimizes the complications like blood clot formation and even and traumatic entry, incomplete procedure. So referral for the same dietary and exercises. Quit smoking services, that it increases the clot. It is not cleat. Okay, clot formation. So risk assessment will be done, and accordingly blood thinner will be given. Okay, so follow up with the patient information leaflet of LARC sterilization, and arrange blood test, and follow up with the senior or the consultant. So the consultant will be the person who will be accepting her. You are here just to guide her. So the final decision will be taken by the consultant. But per se, if she minimizes her weight and stop her smoking, she will be accepted for the surgery. That is my take home message for this consultation. Okay, so here you can just guide her regarding the alternatives also. Okay, now domain wise scoring, if you want to see, history of this obstetric history is very important. Then uh, relationship, social history, including employment, past medical surgical history, previous contraception, smear history, drug allergy, and LMP. Uh, Physical examination, including BP, you had mentioned. Why opting for sterilization? Very nicely, you had asked Dr. Muthulakshmi, because sometimes if you will be asking this type of questions, the role player might feel offended. So ensure your way of asking these questions will be in a different way. Consider other options, including vasectomy. Communication with the patient and families, introduce self and role, discuss alternative like LARC, discuss pros and cons of the sterilization, failure rate and regret, provides information in a stepwise manner as an appropriate pace, ensuring through understanding and encourage answers all questions, consent for procedure, add into the waiting list, give date for procedure. Okay, yeah, so that point even I had missed out. So once she will be here, you can mention once she has decided we need to sign. You mentioned, but I had not mentioned in my answer key. You mentioned, Dr. Muthulakshmi. So once the procedure, once the consultant has accepted her for the procedure, we will take a consent, share with her, keep it, one copy will be in the document, and we'll put her on waiting list. Okay, emphasize the need to continue with contraceptive pill until period after the sterilization, provide RCOG patient information leaflet. Communication with the consultant, link up with the waiting list coordinator clerk, ensure anesthesia is informed, especially the risk of general anesthesia, liaise with family planning if appropriate to provide more information about availability of alternatives, including vasectomy. So for that, you can refer to the family planning. Patient safety, basically contraception next period, up till next period. Okay, when you can perform the procedure, generally post menstrually you can perform, establish drug allergy, urine pregnancy, and not to stop COC till she will be accepted for the procedure. Okay, that is my way of here. Identifying risk of contraindication to surgery, per se here you cannot have any contraindication. You just need to, modifiable risk factor are there, that is smoking and obesity. You can offer her weight reduction and quit smoking services. Options of alternatives like vasectomy and LARC, weight reduction, quit smoking services to be offered. Okay, and PAC. Applied clinical knowledge, it is not a green top guideline, it is female sterilization guideline of FSRH. Alternatives like copper coil, Nexplanon, Intratren, Mirena. Okay. Discuss vasectomy. The failure rate is very less compared to female sterilization. Complication of laparoscopy, because laparoscopy 1 in 500 cases, major complication do happen, and which might not be getting identified during that time. It might get identified after some time. Understanding the current literature on sterilization to women, Faculty of Family Planning and RCOG guideline, NICE guideline, LARC. Okay, so basically the very few knowledge points are required in this task. Overall, you have done wonderfully, Dr. Muthulakshmi. Okay, any question anybody wants to ask?